Discuss the rate of reaction. So the rate of the reaction, or the rate of the degradation, is the velocity or how fast which the reaction occurs. So this rate is expressed the change in concentration or C within a given time interval, or the change in time. If you guys remember physics, it's the same idea basically. A change of the speed was the change of distance over the change of time. So the order of the reaction is the change in concentration within a given time interval, or divided by the change of time. Now, the order of a reaction is the way in which the concentration of a drug or a reactant in a chemical reaction affects the rate. So keep in mind that the rate of the reaction obviously is going to proportional to the concentration. So in most cases, the pharmaceutical degradation or medication degradations can be follow as a zero order, first order, or if it's not zero or first order, it's going to be a higher order reaction, such as a second order. Now, in the real world, the zero order and the first order is what you usually would deal with at your practice. Okay, so zero and first order. And that's why in the test, you're usually expected to know a zero and a first order, but anything else is going to be out of the scope of practice, or is going to be very complicated or complex for you to worry about at this moment. Now, in zero order reaction, the rate is going to be independent of the concentration of the reactants. So it does not depend on the concentration of the reactant. So the concentration have nothing to do with the degradation of the active ingredient. So the drug concentration is going to change with respect to time at a constant rate. However, other factors, they may determine the chemical reaction, such as light or moisture. So we said the rate of the degradation or the rate of the reaction has nothing to do with the concentration. However, there are sometimes some other factors that might determine the chemical reaction, such as light or moisture. But set those aside, in the pharmacokinetics, what we worry about is the rate of the reaction and if the concentration affects it or not. So the zero order reaction can be expressed in the equation of which you're looking at this moment. It's C equals the constant rate multiplied by time plus the initial concentration. So what that means, it means is your concentration over any given moment, okay, it will equal the initial concentration, okay, plus which is going to be minus, since this total is going to be in minus, the constant rate multiplied by time. So if I have 500 milligrams as initial concentration, and my time is 2, and let's say the constant rate or rate of elimination was 0.06. So you multiply 0.06 by the time, which is, let's say, 2 hours. This is going to be minus, and your result, you deduct it from the initial concentration, and this is how you get your concentration at any given moment. Now, based on the graph that we have, and at the same time this equation, and what we talked about the zero order, and it has nothing to do with the concentration, right? What we come up with is the amount of the drug eliminated per time is independent of the drug concentration of the body. So what that means, at any given moment, I'm losing the same amount of the drug. So 1 gram 800 milligrams, 600 milligrams. Okay, and this is your graph, and this is how it looks if we plotted concentration versus time. It will start up here and it will drop down, and your jump from one point to another is gonna be the same amount of the medication at any unit of time. So if here and here, if this is like 1 hour and this is 2 hours, how much you lost in the first hour is going to equal to how much you lost in the second hour. So this is a zero order reaction. Again, 1 gram, 800